we're getting into the critical stage, I guess, with the doctor telling me just a few moments ago about 10 people have been diagnosed with COVID, and they'd like to get the vaccine here sooner than later. If you can sort of explain where we are on that.
Well, first and foremost, I think there's multiple issues at play, but obviously for me, the most sobering conversations I'll have as an elected member is when you get that call from frontline RPNs, RNs, PSWs at Hope Street Terrace, and then obviously the subsequent from their head lead physician, manager of their clinical care, that the reality's on the ground, the loved ones, it takes a special person to look after someone in long-term care, and it's their family. So I understand that, and I think of family members that I've looked after in LTC. It takes a lot of work, and park the system changes aside for a moment, and there are a lot of changes. It's happened over decades, but we are the government of the day, and we've committed to fixing this, and we've committed to addressing this, and we'll be held rightly to account by the people we represent for that. So I'd like to address that because it's important people know what's going on. But in the immediate term, people that are looking for the vaccine need to know, first and foremost, two things. One, we're receiving multiple vaccines from the federal government. We're receiving the Pfizer vaccine, the Moderna vaccine. All the different vaccines are stored, transported, and cared for and delivered differently. The Pfizer vaccine's -70, I believe, it needs to be transported by. So the logistical challenges of doing that, it took time, and it's done with the national, the National Immunization Task Force federally. It's done with the command table. Obviously, General Hillier. We have a general that's dealt with rapid deployment and dealt in what was a very real and challenging situation in Afghanistan, working quickly, is now handling that in Ontario. We're at the mercy of what we get from the federal government. Having said that, we got supplies. We're targeting the priority regions. Where is the spread coming from? GTA, Toronto, Peel, York Region, Windsor, Essex. These are the priority areas. So we're looking at those areas first. We've committed to, by January 21st, vaccinating everyone. We're already seeing in different health networks, Trillium, UHN, etc., coming out saying everybody's now vaccinated. So we're moving around the clock, and we have the throughput capacity. We just don't have the vaccines. Now, having said that, what she's highlighted is a logistical tweak on, can we look at other areas outside of those priority areas to get the vaccine to. First and foremost, if we had oodles and endless supply of vaccines, the answer would be a quick yes, and we'd be rightly held to account. We don't. So it's now on prioritizing where that's going. And so what she's made the case for, to me, just as today, so I hope the viewers can understand, I just got off the phone with her 20 minutes before you came. So I've already placed the call, I'm already talking to my colleague, but it's looking at if the region's right here and the boundary's here, and you've got an LTC that's on this side of the boundary, do we prioritize that if they're an outbreak before an area in this area? And if we shift vaccines there, who's going to communicate to the doctors, the nurse, the PSWs on this side in a priority red zone why you haven't got your vaccine today because we've reallocated it elsewhere? So these are the logistical challenges, and honestly, I don't make that call, but I'm part of a government that makes the call, that relies on the expert advice of physicians, of the vaccine task force. So it's not quite as cut and dry as I can make that call. We rely on the doctors guiding us on this, but it is something that I'm glad she highlighted it, and something that, they're my friends, they're my family there that are working. I've worked with that staff, was handing out hot dogs and hamburgers last summer at their staff appreciation day. These are my fellow neighbors, so it matters.
You can certainly understand their fear, anxiety. Yeah. You can understand that, and it's one of those things. It's not as, I guess what you're saying is, it's not as easy as it sounds.
No, it's not, and I understand when it comes to your loved one, when it comes to me. I'm dealing with emails every day. I'm a teacher, I need my vaccine now. I just got off the phone with a physician at NHH that says, we should get it now. We're intubating patients that have passed away. We're quite literally on the front lines, and I'd like it now, and I get it. I understand. Everyone is looking at this policy and want to know where they fit into the policy, but we've launched an ethical framework, again, available at ontario.ca/COVID vaccine, and it really has put a lot of thought. There's an ethical framework. We have to be compliant with human rights code, with our rights framework in Canada. So, I mean, we have a charter. So we're examining all of that. We have legally binding, obligations to stay true to the principles of reconciliation with our Indigenous communities as well. And look, this is never easy. And so being in a public policy decision when you have limited supply and your job is to start prioritizing is very difficult. But what Ontarians and Canadians should take pride in, and this isn't about different levels of government. People want to know now how their elected members are helping them. They don't give a damn whether it's Liberal, federal, or Conservative. And what I will say is they should take pride knowing that we're in Canada and those decisions are made by clinical experts, logistical experts, supply chain leads, not by your politician sitting behind a desk. And so we do balance that. And the only thing I ask is for the public to understand that when we're making these decisions, the Premier Ford is leaning on the experts.
One of the things that's more down the road than it is now, but with flu vaccines, people can not take them, which could cause great concern. I could see that being an issue in long-term care facilities if staff get to choose whether they have or have not had the vaccine, again, when it comes to this area, because that could put the residents again at risk. So that's one of those things where it's like, it could cause more grief, I guess, if I can say that.
Well, that contemplates some very serious considerations around people's individual freedoms and things that have already been legally contemplated in rulings in the past. And I mean, ultimately, my job right now on the front lines of this is to make sure those who want them have access to a vaccine as quickly as possible, and those on the front lines have access. And what my inbox is disproportionately flooded with people asking when that's happening. Do I have people who feel that they should be exempt or want to know more information, or someone who rightly will ask, what sort of clinical trials has this gone underway? But I mean, what is important to note, and I just actually got a technical briefing from clinical experts this past weekend, that there is a lot of information and study, and it's publicly accessible. These aren't made on the flies. This is through the Public Health Agency of Canada. These are decisions made at Health Canada. There, any vaccine, there is a legally binding obligation to report on anomalies, side effects, etc. And again, I'm focused on those who want one. That vaccine is available, and we're working around the clock on that. And as you mentioned, the flu vaccine, again, AstraZeneca, which we're awaiting Health Canada approval on, is a game changer in that can be transported the same way we transport the flu vaccine. So it doesn't require such extreme conditions to be under to transport it. So again, what I'm trying to hope that the viewer takes away is that it's not quite simple. Vaccine A, it can be sent here or there. Vaccine A, B, and C all are transported differently, all are under different conditions, and all, there are those logistical complexities behind it.
If you can talk a little bit about Northumberland Hills Hospital, are we getting the overflow, if I could say that, from the GTA now? Like, is that here?
Well, what Ontarians are going to see, and what tomorrow likely, and what we're all sort of grappling with as we get that information. It's changing daily, but what I rely on as a local MPP first and foremost isn't even that. I mean, that modeling is vital for me, and I lean on what we get at our command tables, but I also balance that with what I hear on the ground here. And when I call our hospital CEOs, when Ontario Health Team Northumberland comes out unanimously saying these are the measures you should take and we support it, that helps guide me locally. And when we're in the hospital, my concern isn't binary, just a focus around COVID. It's around if your son or daughter tragically, and we know because you're on the scenes there, gets hit by a car or there's a tragic accident on a rural road, is there a bed? Are the physicians, surgeons, are the healthcare professionals with the specialization to deal with the unique traumas of a senior or of an infant? Are they there when we need it most? And that's preserving the integrity of the system. So that's what we have to be focused on, because I've got to make sure that if there's someone sitting at home with the very real concern that the person that they've spent their life with, the person that they just married, has been diagnosed with cancer, stage 4. Are they getting the support? Has their surgery or something vital that's going to give them the information to know a path of clinical care that hopefully will cure that, you know, beautiful significant other that they just got engaged to? Are they going to get that test right away and in a timely manner? And when our system is bursting at the seams, the answer is we're deferring a lot of those you know, surgeries that are priority, but you know, even before then, the elective surgeries to sort of continue to monitor that. And I think of family members and loved ones that are in remission and or, you know, going through monitoring, and I know they want that stability too.
Do you know if we have any yet from the Toronto area?
I don't know that information,
no,
but I do know from conversations I've had with doctors that, I mean, you know, they're, you know, it is quite fluid right now in terms of the pressures in the GTA and having a network to support, you know, individuals, and it's a matter of life and death for many. And you know, yes, I know people at home who are saying this disproportionately affects the elderly. I understand that, but what I'm asking them to understand in return is I have a responsibility. Behind every case there's a loved one, but it's also on the other ancillary effects on the system that will affect someone much younger with a different issue that needs that system. So is the system available? We have a publicly funded healthcare system. Is it available when you need it? And the answer's got to be yes. Here in Ontario, we have a public system that's got to be available.
Last question. What's your message to people that are anti-everything? Anti-mask, anti-COVID, freedom of choice, things like that. It's one of these, I believe we're all in it together. I'd be the first one to say if we're wrong, then I'd be the first one to stand up in a year on a pedestal with the bullhorn and yell, I'm sorry. But I mean, at this stage, is it better to be safe than sorry? And what are your thoughts about these people that sort of are anti?
Well, I think without question, we operate from a principle, obviously, that for everything to be healthy, for a healthy economy, you need healthy people. And I need to preserve the integrity of a healthcare system. Because these are our loved ones, and you know, matters of life and death, as I said, for those elective surgeries, etc. For many, but what I say to them, I think everyone looks at their politicians and says, "Are you championing my interests? Are you listening?" And what I would ask in return, I mean, you know, look, I've had it all, Pete. I've had people tell me to go F off and die in emails, and that I'm not representing them. And look, I respond to them. You know, I'm not going to use a profanity back, but I'm just saying what we've seen elsewhere. Let's not get there where, you know, you need to break a window and I've got to have staff fearing for their lives for you to make your point. I'll meet with anyone, and I really, that's a point of principle for me, regardless of your opinions. I've got to balance them all, and it's not easy. But a lot of people are asking, you know, this lockdown, we live in a free democracy. And so, you know, am I asking questions? Yes. Am I pushing my own colleagues? I mean, we're seeing studies come out on capacity limits as an effective tool. We obviously know that COVID is here and it's not going anywhere for the foreseeable future. So how do we get back to going about normal or new normals, get back to work? People want the dignity of being able to provide for their family. They don't want, you know, business to be a forced shutdown to what they've put their heart and soul into. So I absolutely sympathize with challenges there. There are a lot of people that take it even a step further and are anti this or that, but ultimately they're constituents of mine. So I listen, empathize, try and understand where they're coming from. I'm open to everything. I'm just one person. So when I get studies that are sent to me that are informative, you know, COVID is still relatively new. It's a year just under that we've been studying this and looking at it. I take that forward, and rapid tests and vaccines, we've got to get that rolling out. But we're also talking about business supports to keep our businesses going. We're lucky in our country that we have the capacity and ability to do that in terms of PPE supports, digital supports to help businesses go online. I think people understand that, look, there's no playbook. We're all juggling with this on the fly, but I'm open to a variety of perspectives, and I'm not going to keyboard warriors and those who go online and try and just let's be all cognizant of the fact that at the other end there's someone, and let's not push people to their own mental health issues or to, God forbid, something more serious in terms of their own mental health or what they could inflict upon themselves. Let's be understanding. Let's get through this together.
When you get a chance to get your vaccine, you'll get it?
When we get the chance, absolutely. You know, I'm looking right now at our priority segments of the society. I've looked at the studies myself, and I've gone through and had, as I said, a technical briefing just this past week, and we're trying to work with Ontarians so that the information's getting in everyone's hands. But for me, the priority is getting in on our frontline workers, our elderly, the most vulnerable, and at some point it'll trickle down to, you know, folks like me.